We see a large volume of obstetrics and gynecology patients here. Right now there are 4 OBGYNs that work here, and there are 2 in the community.
Anybody can access these services, patients off the group health or outside the group health. I would say about 25 to 30% of the practice does involve use of the colposcope for a variety of different regions.
Probably the most common is cervical dysplasia, which means precancerous changes of the cervix. So if women have several abnormal pap smears, then they're referred for colposcopy.
Well, colposcopy is like a medical word, but essentially means looking at an area under magnification.
I had some high-risk precancerous cells that showed up on a pap smear, which brought me to Dr. Zare. We needed to find out what type of cells and what type of treatment was required for these cells. I was able to be followed very closely with the colposcope, and I was able to go on and have 2 full-term healthy pregnancies.
We also see women for skin issues like inflammation or hyperplasia or lichen sclerosis, which is actually thinning of the tissues. And I always see these women for colposcopy because then I know I'm getting a really good look.
I like coming to Dr. Zare because she makes me feel at ease, and I will be 80 in July. And I'm hoping to be here when I'm 90 and 100. Took her a little bit to find my problem, and I was grateful for that because she fixed me good.
We have a LEAP machine, a cautery machine, where we can treat. So a lot of our treatments that we used to do in the operating room are now done across Canada in the office.
A test done in an outpatient setting is always cheaper than in hospital, so it's more cost effective to do it in an office setting. I think from my perspective it is more convenient here, it's more time efficient, and I can do a colposcopy any day of the week, so that improves my flexibility to provide care for my patients. From patient perspective, again, I think it's a friendly environment. They already know the staff and the team, so they don't get as intimidated as they would be in a hospital setting.
I think no matter what, when you go to the hospital, your anxiety is a little bit higher, you're a little bit more nervous. Stress levels are obviously not quite what they would be when you're seeing your regular doctor in your regular office.
All the doctors that I've had from the group health center, every one of them helped me. It's good for me. It really is, and probably a lot of other people also.
It's really hard to maintain an appropriate standard of care if we don't have the appropriate equipment. I'm very grateful to the community whenever they come forward with any kind of donation to get a piece of equipment or to get something that we need for patient care. Because that's what it's all about, it's taking care of the patient.
You know, when the doctors need an equipment, you know, to help people, then we should donate to keep us healthy until we are 100.